We're involved in global studies that are looking at single use of immune checkpoint inhibitors, mainly anti-PD-1 and anti-PD-L1, the counter receptor on tumour cells. That's mainly in lung cancer and melanoma. We're also looking at the combination of Ipilimumab, the anti-CTLA-4 antibody, and Nivolumab, the anti-PD-1 antibody in combination, and an anti-PD-1 antibody pembrolizumab after patients have had melanoma removed from their body. So whether there's some that needs to be mopped up, this is another trial we're doing to test if we can mop that up. So just to very quickly go back to the past, it's been known for decades that tumours that have infiltrating lymphocytes in patients, those patients do better. And maybe the reason is that there is some recognition, there is some low-level control. So really what most of the immune checkpoint inhibitors are doing is revealing or uncapping a process already underway and allowing it to then be marshalled against the tumour again, a reinvigoration of the immune response. Probably the most striking data is in melanoma. For both anti-CTLA-4 with Ipilimumab. There are data now indicating survivors 20% of the starting population out to 10 years, so that's certainly a striking result. And also patients who have been on Nivolumab, an anti-PD-1 antibody for melanoma, who were treated in the phase 1 trial. At 5 years, 34% of those patients are alive. Now we can't yet describe, unlike for Ipilimumab, whether there's a plateau, but it looks like there may be the beginning of one. It seems to be a disease that's less susceptible to immune checkpoint blockade. Amongst all the tumours that could respond, it depends on the mutation load in the tumour that generates a new immune specificities. And melanoma has the greatest mutation load, but lung cancers, particularly smokers' lung cancer, have the next highest level of mutation burden. But despite that, there are 20% of patients who are responding compared with 40% in naive or untreated melanoma patients. And that 20% though, if they respond, about 60% of them continue to respond compared with 80% of the responders in melanoma.